Thank you for joining me on Frankly Speaking, Mr. Bill Gates. Do you have a special place in your heart for India? Because India loves you, and we see you ever so often and talking about issues that India should deal with. India at this moment is also hosting the G20 presidency. How do you look at India on the world map of countries to watch out for?
Well, India is super important. In my Microsoft career, a lot of my colleagues came from India. Now Satya Nadella's doing a great job running Microsoft. For the foundation, the country that we've engaged with by far the most is India. And not only are we seeing great progress in India, but a lot of the things that are going well in India show us how we can go to the rest of the world and bring that same type of innovative progress.
What is your real interest on what you wrote about India? And you said India as a whole gives me hope for the future. It's about to become the world's most populous country. What is the hope that you're talking about?
Well, it's great to see that a democracy, even though it's chaotic, that it allows for multiple voices, and over time it picks leaders who care about the health system, who care about the education system. Slowly but surely, as the economy grows, the government has more resources for those things. And so it's the progress since I started foundation work here all the way back in the year 2000 has been phenomenal. I have a lot of charts that show things like childhood death, including measles, diarrhea, and those results are very exciting.
And do you think emphasis on these issues of health, poverty alleviation, of course we have miles to go, but do you think the pace at which India is tackling these issues is something that would be seen as satisfactory, progressive? How would you rate it?
Well, the progress is much faster than most developing countries, and that's why such good models are coming out. Obviously, China did a lot of development, but it did it in a very different way. There are some lessons from that. India now in health, the focus on foundational learning is a fairly new thing in the last few years. NIPPN, which is a really great program that we want to help accelerate the progress on that. So yes, India's, it's more than a glass half full in terms of the great work.
In India, the political discourse is rather shrill. Many people compare the pace of growth in the last 9 years and before that. Do you see any change in approach of governance, especially in the areas that we're talking about, in the last 9 years since the Modi government?
Well, the progress numbers I look at go all the way back to the year 2000, so there's been progress. I will say that the quality of the government staff involved in health work or education work or this digital work, including the financial services, that quality continues to go up. India has a number of great people. The fact that a lot of them are being picked to serve in key government roles, that's a big positive trend, really I'd say of the last 5 years in terms of my noticing that bodes well for the future.
Mr. Bill Gates, we've spoken about the pandemic experience. How do you think India handled the pandemic? Are there any lessons to be learned on what could be done better? And which were the areas where we did, as a country, perform well, better than expected?
Well, India did well compared to all countries in terms of making vaccines. We worked with partners like Serum to help them get going, but that resource was not only great for the country but also for the world. The digital approach with COWIN, where you were able to see, which communities were not accessing the vaccines, and then as we realized, it was the elderly that we wanted to emphasize then, really trying to get them the coverage there, which is the greatest risk up. No country did a perfect job because, we didn't expect the pandemic, and so we were all scrambling to get going. Even the United States was quite a disappointment in terms of how prepared they were to scale up the diagnostics. And so there's a lot of great talk about, okay, we need better surveillance to catch these things earlier on. There's an initiative called One Health to see if something's coming from animals into human health and get that really early. So I do think there are still great discussions about how we do better, both in India and at the global level.
Mr. Bill Gates, also you've spoken about preparing for the next pandemic, which sounds ominous, it sounds scary, to put it mildly, and you think that it's not going to be possibly as easy, if that's the word one can use, for the COVID pandemic. Is it going to be worse? How do we prepare for it? And can you foretell what are we looking at?
Well, governments, a responsibility to their people is to look at floods, earthquakes, hopefully not wars, but even that they have to think ahead, and on behalf of the people, make sure that the capacity is there to minimize the damage. Pandemics don't come very often, and so we really let our guard down. We didn't know how to scale up the diagnostics. Even in the rich countries like the US that have so much in the way of resources in that health sector. And so the innovations now, okay, cheaper diagnostics that you can manufacture quickly, using digital approaches like the CoWIN. I do think we will be a lot better prepared. The next 2 or 3 years, we can't forget the pandemic because we still have more work to do.